appreciate that, Karina. So let's go ahead and move on from laser liposuction. But we're going to go back to laser liposuction for a moment. We're going to talk about tummy tucks, but laser liposuction, one of the advantages of the laser is that I feel that we get a smoother result. You do get a little bit of skin tightening, okay? But it's not enough skin tightening that if you need a tummy tuck, that it's going to replace a tummy tuck. So there are going to be a subgroup of patients who are going to be contacting you. Karina is the first sort of, you're our surgical liaison. They always want to talk to you first. What group of patients seem to want to come in who think they need a tummy tuck?
Right. It's, you know, there's two groups. So usually someone who's had children, they've had kids, multiple or one, and there's tissues the skin has stretched, and or someone who's had a weight loss, and they're now happy with their body, but they still have a little bit more of that increased fat and also skin. So
right. So you're talking about basically somebody who's kind of fluctuated in terms of their weight, whether it's due to a pregnancy, whether it's just related to their metabolism, but they've gotten bigger, and now by whatever means they've been able to do that, they have that they're back a little bit more towards their target weight. So with that in mind, those patients have loose skin. Okay, what kind of complaints do they have about their loose skin when they talk to you on the phone? Because I know it's a real pain for them. They have a lot of angst with that.
Right. So, you know, one of the most is bathing suits, finding a bathing suit, or just even thinking of wearing a bathing suit. But sometimes it can just be even in their clothes. You know, I work out and there's a bulge there, or my pants, there's a bulge in that stomach area. So it's makes them really self-conscious about what they're wearing, not just the bathing suit.
Sure, absolutely. And you can tell that really, when I started SmartLipo in 2007, you were 6 years old? Seriously?
I was not 6 years old. I was in the 6th grade.
Oh, you were in the 6th grade. Well, that makes me feel almost just a little bit better. Not much, but a little bit better. Okay. Hey, Jeff, what grade were you in 2007?
I was just starting my freshman year of high school.
Okay. Oh, you're an old guy then. Okay.
Come on.
Okay. All right. So, so the patients have, they have this loose skin, and you can tell that Karina is a little bit younger. She's wonderful. She can identify and is a great source of information for all of our patients of all ages. Having said that, one of her comments was that it's the bathing suit. I'm thinking about my bathing suit. I have this loose skin, maybe from having babies as a mommy. And then there's going to also be another subset of patients who, and a lot of times these are patients who are kind of perimenopausal. And so those are the women who are kind of getting in near menopause, their metabolism's changing, their after menopause, and they have a lot of loose skin or some excess fat. And they're finding that, as you said, they just can't fit in their clothes anymore. And it's very bothersome for them. And in fact, a lot of times they're afraid to get disrobed in front of their partners just because of that excess skin. So those kind of patients, we recommend that they have a tummy tuck. Okay. So can we do those under local anesthesia?
Yes, they can be done for most patients. So there are some limitations as well, but if you are interested and you have questions, we can always help guide you in the right direction.
So what Karina is talking about is there are some limitations. So our niche is that we do everything under local anesthesia. So if you have a moderate amount of skin laxity, a moderate amount of fat, that we feel confident in being able to take care of you, to give you the best results, having it done under local is amazing. And again, your recovery is going to be so much quicker. We're talking weeks versus a month and a half of recovery. And I feel very strongly about the fact that it's a tremendous way to go. However, as with anything, there are limitations. So I tell people you can take 2 aspirin, but you can't take the whole bottle at one time. So it's the same thing with local anesthesia. We're limited to a certain amount, and we know how to calculate that scientifically for the safest doses for our patients and how much we can do. So it's important for us to have the patients ahead of time send in photos, and you always ask them to do that. And that way we're able to evaluate the patient ahead of time to see. We don't want to waste their time. For instance, if somebody's had massive weight loss and they have aprons of skin, we're not the center for that. We would go ahead and refer you on to a center that does a lot of massive weight loss patient tummy tucks.
Right.
Okay. But for a good majority of these patients, we're able to actually do this under local, where we remove that excess skin and can tighten up the abdomen as well. And we can get some really great results with that. Yeah. So
we've seen great results.
We've
People
seen
are super happy with
super happy with that. And just getting rid of that excess skin where you have to sort of pull it up to slide it under your belt can be very disconcerting for patients. So that's really a great treatment. So a tummy tuck can be done under local, quicker recovery. We do remove the excess skin and help to tighten up the muscles in appropriate patients. And we're going to help you. If we're not the right center for you, then we would refer you on to the appropriate center.